work that's going on in our backyard. So be sure to check out all those events. They're on domistation.org/TLH Startup Week. You can take a look back at all the incredible events we had throughout the week. But there's still time to join us at Eve on Adams at 4 to 7. And if you want to party over there, walk over, join us at the closing event at 3 p.m. here at the Challenger Center. It's been an incredible week, and it's been incredibly building these relationships and creating these organic collisions in our community. Without further delay, I will bring up our next presentation.
Hello everybody, we're with Connector, so we're going to be discussing that today. So first of all, I can get started with what is Connector?
Connector is a technology startup that is going to eliminate the paper burden and the new patient check-in experience.
And so how did this idea come about? Was this?
Well, I guess I can start off and then you can follow up, Andy. So Rubos, as some of you may know, is in public health technology. We've got about 100 employees across 20 states and 2 countries. And we've been doing this for 18 years. And in addition to what we do with Rubos, we've also been very involved with Nomi Station. We're very grateful for everything you guys have organized. But also Launch Tally. The goal of Launch Tally was to create a platform ultimately to highlight the technology companies that are in our community, which are flourishing, which many people do not know about. And so a few months ago, I received an email, that's an Aubuchon, with a question, and I will let her take it from here.
So I emailed Eddie something along the lines of, I want to talk to you about something that can help a lot of people and has to do with healthcare and technology. Thankfully, he said yes, and what led to me wanting to send that email was, like many people, including maybe some people in this room, that you deal with health issues and you have to go see new doctors and you have to fill out new patient forms every single time. Well, this past year for me, I was experiencing what I now know is rheumatoid arthritis, but it took a lot of new doctor visits in order to get that diagnosis. Rheumatologists, neurologists, I was experiencing carpal tunnel in my hands from inflammation, so it was actually painful to write these new patient forms. Every new visit, having to fill out my family medical history, my medications, every surgery that I've had in my life, and family medical history that I wasn't even sure if I remembered correctly about my dad or my uncle, and having to physically do this was, my handwriting was messy. I was wondering if they were even going to be able to read what I was writing, and I got mad. Honestly, I got frustrated and annoyed, and couldn't believe that in 2022 we have all of these amazing apps that do anything you could want, but we're still filling out the same form, going across the street, filling out the same information again, and then having to be asked, is your pharmacy still Walgreens? Is this still your primary doctor? And sometimes the answer was wrong from somebody I'd seen 10 years ago. So it was just blowing my mind, and it wasn't something that was new to me, filling out these forms, but it was painful having to do it so frequently and physically challenging. And so that's when I got frustrated. Ended up talking to my friend Dr. Nick Barber, who's a local retina surgeon, and just said, "Is this crazy? Like, isn't this annoying to you and your staff because you have to fill out handwritten information into a computer?" And I was like, "Yeah, it is hard. It is frustrating, and it would be amazing to have something that made that easier." And so the more I thought about it, I couldn't stop thinking about it. Eddie and Rubos came to mind because I had known about their work in healthcare and technology and their support for Launch Tally and entrepreneurship and innovation. And I thought, well, if anyone's going to tell me this has been done or it's a bad idea, it's going to be Eddie. So sent that email. Thankfully, he said yes. And that conversation, Josh was on the phone with me, was just really energizing. And I could tell that he was like, let's talk more about this. This is something our team cares about too, because we are very much in the work of breaking down those silos and creating efficiencies and with information in healthcare. And so one thing really just led to another over the past 6 months of meeting with the Rubos team, understanding their areas of expertise, which they've just been incredibly valuable, like invaluable in all of this because of the doors that open and the understanding of that security, and it's been a really like mind-blowing, surreal, in a good way experience for me, because this is not the space that I work in, but it really feels like we're about to solve a problem and help a lot of people. So.
Yeah, and then we had our first meeting. Juan was there, Matt was in the audience, was there, of course, Josh and a few other people. And at first, we're thinking, okay, you know, we're used to doing really complicated things and sharing words like interoperability with doctors. And what was interesting, you had these highly technical people in the room, and they all agreed that why don't we take a simple approach, right? Instead of going to a doctor's office and speaking to the frontline staff and the nurses about HL7, which is a standard, and data exchange, and health information networks, and all this complicated stuff, why don't we focus on the first step of the patient experience, which is that intake process? And for us as Rugos, you know, doing work now for 18 years, one of the things that we realized is that we don't do enough work in the community. So for us, this was a great opportunity to give back to the community where our families live, where our children go to school, heck, where our doctors are located, and of course the 2 hospitals. And so for us, it was a great opportunity to collaborate. And the last few months, and Juan could probably chime in, the last few months have been, I mean, we've been launching this, you know, we are in the Challenger Center, we were very grateful for it. Artemis just launched. We've been launching, right, Juan, over the last 2 months. I'll let you chime in there.
What's most exciting about that is whoever we speak to about this, whoever we share this topic with, it seems to be something that we can all relate to. Me coming from the public health and the medical arena, I have an understanding of that intake paperwork. However, as a patient, as a son, as a father, as a caretaker, we all have some type of person that we can identify as that this can help. And so we can all relate to it. And a lot of people in the community, really anyone we've spoken to, has expressed their support for this idea.
I think that speaks to Tallahassee too, and the size of our community, and the fact that we are seeing such collaboration, people wanting to see this be successful for patients and providers.
Yeah, and on that note, I mean, we did a market analysis of, because obviously one of the first questions we asked was, there's got to be something else out there that does this. And there is competition. And we're okay with competition. But what we realized was that the competitors and the other options are trying to solve 10 or 20 or 30 things for a doctor's office. We're trying to solve one thing, which ultimately will have a ripple effect in a positive way. The other thing that we noticed is that a lot of these other organizations are trying to do it across the state, across the nation, in 12 different cities. Our goal is Tallahassee. We've received phone calls over the last few days since we announced on Wednesday of, hey, when can you come to Miami? When can you come to Orlando? And we're respectfully saying, we want to focus first on Tallahassee. We want to do it right. Built by Tallahassee, for Tallahassee, with the Tallahassee community, from the event that we're going to have December 8th to the marketing folks, to the folks that are printing our swag. We're really focusing on the community of this one, and we're not going to sway away.
Yes, and I worked closely with Eddie for quite a while. Now I am part of his company, Rugos, but previous to that, I worked with the Florida Department of Health, and his team managed our data integration. I've always really thought the world of the work that they do nationally, and I've constantly said, Eddie, you guys do such great work. We really need to do something here directly in our community here in Tallahassee. And, technology is growing and expanding, and there really are still a lot of gaps as far as healthcare, specifically here. Not specifically here, but I think there's an opportunity for us to really make a difference here in Tallahassee as far as interoperability and digitizing our information and making things more timely, so on and so forth. So I've been having this talk with Eddie for a while, and I'm really excited to see this come to life.
I think the timing is right, though, Allison, because we have 2 alleys, Aubuchon and Culpepper. And so I think the timing is right, because people have tried to do this before, right? So we spoke to another local group here, good friends of ours, who did this in 2005 with some success. But as COVID kind of winds down, I think something that we realized was, we can listen to what an administration says about the situation around COVID or the Surgeon General, et cetera, but healthcare is local. At the end of the day, you're going to go to your primary care physician, and yesterday was Rural Health Day, I believe, but you're going to go to your primary care physician, you're going to go to your friends and family, you're going to go to your local pharmacy. And so, once again, tying it back, right, Allie, to local community, focusing on Tallahassee, and the response so far, which has been amazing.
Yeah, can you speak more about the feedback you've received so far and the interest in Well Connector?
I think it's been supportive across the board so far, thankfully. We've had several physicians reach out after we shared on social media and with people in emails this week that want to be a part of the pilot process or, have other ideas. But we're in a stage right now where, it's development and research and feedback and getting into a pilot, and that's going to be so helpful to, I think, as your team has said, not over-design it for one particular office or clinic, because there's going to be so many different scenarios, so many different types of patients, and talking to the clinical staff in the offices, and so we're really grateful because so far, from at least from the medical community, posted back or emailed back, they're like, wow, this is great, how can we help? And so it's been
Yeah.
Yes, and Allison and I actually met with a few physicians here in Tallahassee just to get their feedback. Do you need? Okay. Just get their feedback, and they all say, this will significantly help us. We talked to a rheumatologist. We've heard from a pediatrician. My sister, she was unique in that she's a nurse, pediatric nurse practitioner, but she works in the county health departments. So she deals with a lot of the Medicaid population, and she said this will really benefit that population as well because they're constantly, go into different clinics and they don't really have an established provider. So having that data and information readily accessible will really help that population as well.
So looking towards the future, what is the future of Well Connector? And what is a well-connected Tallahassee?
Yeah, and I think that's a great question. Number one, you mentioned Well Connected. One of the other goals of this initiative is to bring the healthcare community together, right? Once again, we realized during COVID that, we have to play ball with each other. Right? Let's try to break down those walls, or what we like to call data dungeons, and let's share data, because at the end of the day, we're all in this together, both public health and the private sector healthcare system. And we're lucky here in Tallahassee that, our public health agency, which is one of the most advanced technologically in the nation, is located here in South, right? But I think our future, there's two kind of parallel routes that are happening, right? So number one is continuing to refine the messaging and get feedback from the community. We've got right now looking probably for you to, close to 100 people across the nation that are extremely bright, smart, and can develop an app tomorrow. But if we're going to develop an app without a nurse's input, the person who works in the front desk, without the physician's input, what good will that do? And a lot of the competitors out there have done that, right? They first made an app, and they started to implement their locations, and no one asked the nurses, or no one asked the folks in admissions what they want. And so part of the next 3 months is going to be a pilot where we're going to have a feedback loop. We're going to have kind of a community/user group from folks from the community to say, hey, Eddie, or Allison, or Juan, or Allison, or Whitney, this idea is horrendous. You should look at it and do something else. Or guess what? You should do it this way. And so having that feedback loop from the professionals that are working on this as we sit here today, I think is going to be important over the next few months. And we're going to be looking for champions. We're going to be looking for people who are interested in providing feedback. And you do not necessarily have to be in healthcare. You can be from other industries that have ideas. Heck, you guys are all patients. You can tell us that you're tired of filling out the physical form for your child, or the same HIPAA form for you and your family. And so we need that feedback to truly create an application that was created by the community.
I guess, as a patient who's dealing with insurance and an issue a person had with chronic disease in general, lifelong, how do I bring in the past items mentality of fighting for what my choice of the patient is versus what the insurance trying to do for profit? that doesn't work for the first time right now, as a patient with the insurance system as a whole, I'm fighting for a drug that I'm not my whole life.
Right.
You can't tell me that they want something else with the money and not what I've been through.
Yeah.
So it's not answer for today, but something wonderful with this program. It was awesome, by the way.
No, thank you. No, I mean, I think, we're not gonna be able to solve, right before you walked in, we're not gonna be able to solve all the challenges in healthcare. We're really gonna be focused on that intake process. However, we do know that, or we do believe that the data, the quality of the data will be better,
I
right?
will say, I'm sorry to interrupt.
No, please, go ahead.
I very much relate to that because there's certain medications that help me that I have to kind of prove that it's going to be the right one. And sometimes that first response is like, well, but the first thing that they're on should be working. And you then have to go back and say, well, this is causing these other problems. So this is why I need this other thing. So I think for that situation, having that handily available of how long you've been on that medication, not having to remember or look back through your planner, having that information more handy, at least for me, I know I can very easily share that and why that hadn't worked when I have to prove that in the future.
In my case, it's just a battle with insurance because they don't want to tell me why they go to person like that. And I don't want to try to go all for them out so long. So it's just it's only a discussion for offsite later, but
Yeah.
it should be an issue with the patient to advocate myself so strongly that I'm having headaches and just internal frustration with the system as a whole that's turning me off from the physician who's been for several years. Just follow the orders of insurance and tell them what they prefer to do for the patient.
Tim, I don't know.
So if I may, again, this is not specifically to the issue with your medication and your insurance, but what I find really beneficial with Well Connected is that in this aspect, the intake process, the history sharing of information, it's giving the patients the ownership. As you're saying, you're talking about a situation with your medication, and you'd like some, I wouldn't call it control, but ownership.
Better understanding the
decision
insurance side,
making.
because like they're telling me without a reason other than obviously money that they're telling me that it's not fair. That's not fair to the patient.
So in this instance with Well Connector and the intake process and the sharing of information, it kind of gives you a little bit of control of how that information is shared and what information is shared. So that's pretty cool. And then another part of going back to your question is from a technical aspect of a project, we really want to understand who the stakeholders are. And what I find amazing about Well Connector is that not only do the patients, us as a community, benefit from Well Connector, but so do the office administrators, the providers who are providing care for us, the intake person, that person at that front desk who has to look at a form and says, I don't understand the handwriting on here. Now they got to ask you twice. Or they put the information in wrong. Now the provider has to ask you another time, as Allison alluded to. This provides a solution to not only you filling out forms, but also to the quality of the data that providers are using, which should ultimately improve patient-provider relationships, quality of care, and the quality of the data that goes into your medical record by simply finding a solution for sharing intake information, what we fill out every time we go to the doctor. So we are working with all of what we call stakeholders, but really the community, to get that feedback so we can find the best possible solution.
It does. It provides a digital paper trail for you. So, who's to say that we can't interface with an insurance company, Capital Health?
Absolutely.
And you can send us and say, here, I've been on this medication for 10 years. This is the medication that works best for me. And often, just in my experience with public health and looking at data in general, I see that sometimes, specifically in the hospital setting, diagnoses are coded based on a diagnosis code, and sometimes certain things will get coded into a different category, and insurance is looking at that diagnosis code. So having that specific paper trail really gives you more power in what is best for you.
Julie had a question.
Yeah, this has been my pain point forever. Like, I have 4 kids, so I've had to refill those papers. I don't have any joint pain or anything, but I still hated doing it over and over again.
I was like, why do I have to freaking do this over and over again? I'm used to Kaiser Permanente in California, and I didn't have to do that often. So I don't know, is that something that maybe it's a completely different model or something? Maybe that's something that you can look at. But I really loved how efficient the system was, and that was more for HMO patients.
Yeah.
But is this something that you plan on doing for not just, I guess, healthcare in general, but also dental care? Because I would love if it was more streamlined up costs.
We have had some discussions with folks. Someone actually just went from our team to a dentist. A couple people went to the dentist recently, and actually it can be applied to that. I Associates as well is very interested. I mean, going back to your Kaiser Permanente thing, what you see throughout the nation are these health systems, right? So we've got HCA out of Tennessee, right? The largest health system after the Veterans Administration. You've got groups like Kaiser Permanente. Now they, for the most part, they have their integrated software. So if you go to a Kaiser, it's pretty consistent. But as you see in our community here, we've got they all have electronic health record systems. Or some people like to call them electronic medical record systems. And it can be Epic or Cerner or Athena or Next, all these large, huge companies. And each one's a little bit different, right? It's going to be hard to get Capital Health HCA to do the same thing as TMH. So our goal here is we're agnostic, right? And so we can play ball with the different vendors. And I think that's the key as well. And so, Kaiser Permanente is a very good example of a success story. But how do you get that, data from one health system to the other when oftentimes they're competitors?
As we start to look at some flows of, let's say, some examples, I'll use myself as an example. I have me and my kids. We go to the dentist. Okay, they're asking really some of the same information, some of it a little bit different. And then the flu rampant right now. So now we have to go to CHP urgent care. And then we get sent to TMH. That's 3 different systems. And each one does have some type of electronic intake or information sharing where you have that as part of your network. But now we're in different places, especially here in Tallahassee. And so it gives us, again, the ability to have our information in one location and be able to share it. And as we've seen with a lot of the local partners, is they're willing to support this effort. And
I can see, I can see Julie with your 2 kids. Those that have been to Tallahassee orthopedic, your 4 kids. 2 kids. 4 kids. We have an employee who's watching that with 6. Okay, for those that don't have fronts. And so he represents 10% of all the children at Rufus. By the way, we have 60 kids. So imagine you go to Tallahassee Orthopedic Clinic, and we've talked about this. And they've got 8 windows, right? And there's a bunch of lines. You sit in there, you're waiting for your paper to come in. You're stressed out, you've got your business, you're an entrepreneur, you've got all these things going on, your children. Well, imagine on the right-hand side, there's a window with a Well Connector sticker, almost like a TSA pre-check. And you go up there to that window, and you show them the QR code on your phone, and that data then it's either printed on their side because they prefer paper, or it goes into their health record system. So you're bypassing that other lines because that provider has implemented Well Connector. We believe, when people ask about growth, we believe that more and more, like for example, if an Allen goes to a doctor's office and he doesn't see that Well Connector sticker, he's going to go to the physician and say, hey, buddy, or man, why aren't you part of the Well Connector network? Right? And so we believe the market will hopefully, the patients will hopefully drive that as well.
We've also had discussions about expanding this out to mental health, like therapists and psychiatrists, because there's a lot of patient intake that goes into that as well. And the rheumatologist that we spoke to, we were talking about gaps in general. She's like, we're always interested in wanting to know about patients' mental health, if if they're seeking psychiatric treatment, if they have something that we need to be aware of. So really having that information readily available and interfacing with all of those different types of groups is possible.
And there's so many different types of practices. So like one intake form, you might have to circle where it hurts, and others, dental versus rheumatology. It's all a little bit different, but 80% of those new patient forms are kind of the same, right? It's the medication and all that. So if we can, streamline that process, and maybe as we check in, there might be a couple questions like, oh, can you just answer these couple of questions real quick, or as you work with partners, be able to tailor it in a way that it's still getting them all of the information they need that's part of that pilot process that we're gonna be moving into, but.
So as far as the pilot process, is there a certain timeline that you're looking towards for getting this into doctor's office?
Yeah, we're looking at March of next year. So we'll talk about this as well, we're having an event December 8th at the TCC Center for Innovation. Everyone's invited, it's gonna be great. We're gonna have doctors there, we're gonna have physicians, community leaders, we want patients there as well. And that's another way to recruit champions. That's what we call the champions, and folks that are not only interested like you all to give feedback, but also to be able to apply it to software. Now, one of our goals of December 8th is to give you a touch and feel for what it's going to look like. Right, so the goal is to have iPads available and phones available for you to get a feel for what that's going to look like. We're also going to update our website as time goes on with more of a demo, so you can once again see what that user experience would be like on your Android or on your iPhone. So we're looking at March. Hopefully, a few doctors' offices and hospitals will have it. I think there's another question.
And you also, I'm assuming you also have an ability for people to sign any kind of HIPAA documentation that they need, because that's always super annoying too after you fill everything out and then you've got to sign the HIPAA.
Yeah, absolutely. And the key, one of the keys, we've all been there where we sign documents and we haven't read them. I'm not saying you want to read the documents, except for certain, attorneys and others. But, the idea is that you can, at home, the day before, 2 days before your doctor's appointment, you can pre-fill a lot of that information and take your time to read the information, including, a HIPAA document or consent and things of that nature. And that would be pre-filled. Also, we would take care of any updates that are necessary, and it has the state of Florida, for example, they've got their template for a general physical form for your child, and then they have one for those that play sports, right? Often, as Allison knows, the Department of Health will change those forms, and guess what? Your doctor's office is going to give you a new form, and it's for one field that changed, and you've got to fill out the whole form. The idea is that we will take care of that ahead of time.
That reminds me, maybe it's a different kind of problem, but because my son has a very mild peanut allergy, and they make us redo that whole process every year, and it's the same information. Is there? I don't know if it's a county thing that they have, it's required that we have to do that, but I don't know if that also can help.
Well, I think you're the first patient user group member. I mean, with all your feedback, you should
Yes,
Focus group.
focus group number one.
And
I'd
so
be happy to.
we have actually talked about working with the health department and the county health departments. They have a different structure, but we have reached out to them, and we do plan on working with them for that. A little bit more of a bureaucracy, but it shows a perfect use case for a situation where you're filling out the same information, whether it's from year to year or from specialist to specialist. You have that information ready so that if you are asked for it, you'd say, well, if you're a well-connected partner, I can get it to you right now.
I verified
And
that
so-
this is still accurate. There's been one tiny change that I just had to change real quick, and now it's approved by me to give to you.
That's our goal.
So how's this funded and how's it you guys do it?
A great question. So, and this is a good example, especially through Entrepreneurship Week, Startup Week, is number one, the community came together. Our friends from the community came to us with an idea. Rugos were grateful. We've been around for 18 years, right? And so we're in a position where one of our goals really for 2022 and 2023 was to do things locally and invest funding into local projects. And so guess what? Now we have them. And so we're this is all being self-funded, right? We're not we don't have any outside investment and complicated variables that would really create at times obstacles for us to get the work out there. And I will make it very clear. I know the Aubuchons and Allison and Juan would agree, so Whitney, is we're not sitting here with a spreadsheet trying to figure out profitability. Now, we understand we have to run a business, but that's not our goal here. Our goal here is to ultimately, truly, quote unquote, we have day jobs, right? We're busy already, right? And so our goal here is to get back to the community, help our families and our friends, many of them in the audience. That's number one goal. Now, we also understand we have to be responsible and figure out what that payment model would look like, right? And that's part of that feedback loop. When we get this in the hands of the doctors, the nurses, the frontline folks, we want to see them get value and then tell us what they would be potentially willing to pay, right? And the idea is not to put the burden on the patients. Now I can see, a time where insurance companies are going to start asking questions, and as you can imagine, we're going to get ready for those questions. But we're not sitting around trying to figure out margins. We're trying to figure out how to get this out to the community ASAP and take advantage and capitalize on opportunities like this to share our message.
It's really just been something that we're passionate about. It doesn't even feel like it work. It's just something that we really believe in and we want to see happen. And I think that's what matters most.
Yes. And I think we've had these conversations about equity and information barriers for people. And I think at the end of the day, for the patient user, it needs to be free for them no matter what. That's remarkable.
And now that you mentioned that, both Allie and I come from a public health background, our experience with the Florida Department of Health. And then through Eddie, one at Rubos, but two as a health informatics professor. One of the things that we've really tried to marry over the years is how to bring healthcare and technology together for the benefit of the community. And this is just another opportunity to do that.
One of the things that many people have talked about in this discussion, whether it be themselves first person or even their children, I watched a video on the website. It was done very well, and in that, one of the stakeholders that was referenced is more like elderly, right? And I think that's something being very thoughtful about it, which was great. I've had an experience recently with my little man, one of three, that were having some health issues, and there was a grandfather in front of me. So speaking about the stakeholders, we're talking about somebody that could be removed from that. So this is a great solution for that, right? Whereas even as dad, maybe call a mom like, hey, when's the last time we such and such, and which kid was this, and things of that nature. So I couldn't imagine, the grandfather in front of me and their person at the front desk asking about some information. And this little kid, I mean, they're probably removed, greatly from that sort of tool like this is very impactful.
Yeah, absolutely. And I think, my real understanding, even when we were just describing that, I mean, thinking about children who are in foster care, children, who are in shelters, or families that are divorced, that maybe, the father needs this information, and they have the app now where they can easily pull it. I think there's so many different use cases out there that would benefit not only the provider community but the patient community as well.
Since working on this together, I think all of us have been hyper aware in waiting rooms. When you do have to go for a visit, you look around and you're like, that person clearly isn't with the caregiver and is struggling to remember their insurance information at the check-in. It's just like, it's frustrating. And you're more aware of it. I think working like this.
I have a suggestion. Eddie, Lawrence Guerra, right?
Who's that?
Lawrence Guerra, I don't know if you met him yet. Yeah. So he's at Harvard now, but he was among us in the Adobe circles, and he would be a great contact because his check-in system that eventually was acquired by somebody, that was a really awesome, efficient system to get checked in. But he went through the process of getting approval through the whole bureaucracy too.
Yeah, that's a good point. Thank you.
Yeah, so he probably could give you insight about, and he focused locally too.
Yeah.
So he can give you insight about the app and everything as well.
Thank you for that. That's very helpful.
So you're talking about your background in public health and Rubos being a technology company. I want to talk a little more about the partnership with WellConnector and how Rubos is especially set up to make WellConnector happen.
Yeah, I mean, first of all, we were honored and grateful that the Aubuchon family came to us to just ask for our opinion. And then when we were in that first meeting, all the eyes opened up, and especially some of the technical folks, they said, oh my God, and one of them is back there in that bar. This is an amazing opportunity to take what we've learned over the last 18 years with big data, with the CDC, with the White House, and with states across the nation, which, it's put us through kind of like the gauntlet of pressure and having to deliver data. Security was mentioned. I mean, we're, securing very sensitive data today. So, I think we're well equipped and in the ready position, but we also acknowledge that we're going to be learning a lot too, right? We don't have all the answers. And so, once again, we're grateful that they came. And I will say that the Aubuchon family, you know, we've all been part of potentially different entrepreneurial settings and partnerships, quote unquote partnerships. Often, you know, one partner does more than the other and it gets a little complicated and you're trying to figure out where the other partners are. The Aubuchon family, you know, Josh and Allison have done an amazing job. And really because of them, and of course other folks as well, we've been able to be here today talking about it, right? And in less than a month, we're going to be at the TCC Center for Innovation, you know, showing you something, which is remarkable. And it just shows you could be in Tallahassee, you could come together from different, you know, different expertise, backgrounds, things of that nature, and take something to market that we feel will make a positive impact for the community. So, I mean, it's happened so quickly. And then it also happened around the startup week time, which was, it was just remarkable, all the timing and the stars are kind of aligning, which is fascinating. But I do think that, you know, we're ready to go. There are people right now that are working on it, but I do think we're going to learn a lot. And I'm looking forward to that as well. I know the people that are watching on YouTube are also excited from a Rubos perspective. You know, we've been working our tails off for 2.5 years to move that COVID data across the United States. And there are people that are watching this YouTube video that, I'll tell you right now, are tired. Maybe some of them are burnt out or exhausted and doing something a little bit different, right? Private sector, providers, something that is not interoperability per se or federal government-wise. I think that's bringing some excitement to our business that's 18 years old, but it's kind of bringing those entrepreneurial juices back, which we need. We definitely need. So we're very grateful.
Okay.
So, sorry.
No, I was just gonna say, you know, we've all been working the pandemic for a little while on the public health side, and whenever I found out about this, I was like, this is exciting. This is something new and something we're all passionate about. So I think that really matters.
Yes. One of the things, I joined Rubos about 3 years ago and realized that a lot of our projects, as Eddie mentioned, are federal projects. And we're providing, one of our mission is to provide clever and efficient solutions for the communities we serve. One of the main lessons we've learned in the last few years, while we've been helping at a national level to provide solutions, is that healthcare and the solutions to some of our public health issues happen at the local level. Healthcare happens locally and individually. And so, as our leadership at Rubos has mentioned recently, is let's start focusing locally. Let's provide some clever and efficient solutions to our communities. And then we meet Josh and Allie, and they bring this proposal to us, and all we can do is look at each other and smile like, here's the opportunity, let's do it. And so it's been really exciting because it's just been fast-paced and let's get it done attitude. So it's amazing.
It's been so exciting, and you guys are amazing to work with.
I really love what Eddie said about how we're agnostic, and just throughout my career in informatics and public health in general, breaking silos is so important. Just working with different companies, different groups of people, and not everyone kind of doing their own thing. And I feel like right now in healthcare and IT in general, especially in our community, we have so many different EHRs, and everyone's using their own little patient portal, but none of them talk to each other. So really breaking those barriers and silos is something that's
And I think, I agree with you, Valley, and I think there's a lot of divisiveness right now in our community. If we can use technology and healthcare to bring different communities from different zip codes together, imagine, for example, a community session or focus group with TMH, Capital Regional HCA, TPCA, TOC, all of the different competitors in one room. Whether the application works or not, that to me is a success, where these competitors will come together and say, you know what, we have an opportunity to improve what we're trying to do here in the community. And that's kind of like a byproduct of the techie stuff that we're trying to do, which I think is fascinating. And I urge the healthcare community to come together And then one day, Alan's gonna go to a doctor's office and they're not gonna have the well connector sticker, and he's gonna say, hey, where's the well connector sticker? And so I think that naturally is gonna happen.
He's human for that.
Yeah, he goes there. They listen to him.
I'm not sure if we're going on time. There's one more question, and then we can open it up to some more questions from the audience. But so, where can people find more information, and who can get involved? Providers, patients. How do they get involved? How can they help us?
Well, on our website, wellconnector.com, there are 2 surveys. One is an anonymous patient survey, so if you have feedback and ideas already, you can go ahead and add some information in there that we would use to help inform the process. Also, a provider portal to be able to share some different questions. If you'd like to follow along just for updates in general, we have on social media the @WellConnector on Instagram, Twitter, and Facebook. But sign up to learn more, and we'll keep you guys posted. But we do have many ways to get involved, either just from the online input at minimum, or even participating in focus groups. Like some of you would be perfect focus group participants. And then from a provider standpoint, being partners or champions to actually be the ones to test it out in their offices with their staff and patient feedback. So that would be, the largest way.
Yeah, I agree. I think there may be some people in the audience that have services that we can work with, that you can bring to the table to help us make this happen. And then of course, Allie, there's a big party December 8th, right?
December 8th at the Tallahassee Center for Innovation. We're very excited because at that point we'll have, are we calling it a demo? Prototype. To allow people to kind of play with and test out to see an early concept of what it's going to look like. We're going to have several guest speakers from the community, from the business community, technology community, healthcare community, all there. And we'll be able to have conversations to share even more. So please join us then as well.
Yep.
Are you guys meet the same floor over there, or is that just not?
What's that?
You want to attend at the same floor, or is that not you guys?
No, that is not us. I believe that is Newside, which are friends of ours as well. But one of our goals when we were talking about sharing our story was we were happy that this was happening here, because we wanted to find a way to support this establishment, which Alan's doing an amazing job at leading. And then we said, okay, we're gonna have a party. Do we do it at a hotel or a conference? No, let's go to the TCC Center for Innovation, which has gone through some challenging times, which they're remodeling. I know Jim Taylor's there with the Florida Tech Council. We're involving them. We're involving La Florida. We're going to have it there to remind folks that this wonderful building and area is flourishing and is going to flourish even more.
Who does marketing calls when you're that point?
Who does what?
Where's the marketing person for the group?
The marketing person would be Allison.
She's a gem too. She's very talented.
Yes.
Well, let's give everyone a round of applause.
Any other questions? Great.
Thank you.
So everyone's here.
Thank you so much.
Thank you. Always great.
No,
Yeah,
My body got me when I saw you. And your question, I know we've had this conversation before, and
Josh,
you could be one of our advisors.
I'll keep rocking it. I'll support. Good to see you, brother.
Yeah, any of these. Just because our team is based on and equipment and security, even if it's just